Okay, so thank you, ma'am, and classmates for that productive sharing. I do hope that we were able to fully understand, fully consider the nature, the difficulties, and challenges of this special population, which are the substance users, substance dependent clients, no? And in some way, we are aware what are the things that we are up against, what are the possible complications that these clients might incur if we are not going to intervene right away. So we will proceed with our discussion. This time around, we're going to discuss about the counselor competency. No, so who will be the most eligible, who will be the most competent to make approaches, to make assessment, to make interventions for these special clients. No, so it's really adequate or really important to have sufficient knowledge and training and competency, no, so that we can extend the appropriate therapeutic intervention to these special clients, no, with the ideal of helping them cope up or helping them overcome their substance addiction. No, that's the most important thing that we are putting into consideration. And as much as possible, we want to be successful with these patients and uh, at the same time without worsening or aggravating the client's present condition. That's why it's really important that uh, we enhance ourselves in terms of the eligibilities and the capacity trainings, no, so that we can be more effective with these clients. So what are these counselor competencies that uh, we should take note should we deal with these patients? So number one is to have a master's degree, no, in psychology and counseling, the basic knowledge on psychological and counseling theories. So it's really important when you have a uh, master's degree in counseling. Uh, it gives us an advantage because we will have the core knowledge, the skills, the proper attitude in the delivery of counseling services such as assessment, counseling, planning, and implementing of therapeutic interventions. No, it's also nice to have a base, no, a base on psychological and counseling theories, because through these theories, this is where we're going to cascade, or we're going to build upon our interventions so that we can implement perhaps behavior modifications or belief alteration for this client. So it's really important that we have that psychological and counseling theories as our base in terms of coming up with interventions. No, in the master's degree and like ourselves in the doctorate degree, we are also given the foundation on the psychiatric illnesses. So we have talked earlier that substance abuse disorders also has the tendency to have the comorbidities for other psychological disorders such as hallucination, sleep disorders, depression. So those things are also important that we have the idea or we have the background for these illnesses, types, causes, symptoms, and its effects. No, and it's really important. I think one of the most important advantage of having the master's degree and postgraduate degree is that it help us in terms of being the facility to build rapport, no, to build rapport and to solicit the trust from our clients. So I think that's what we call the uh, therapeutic alliance. No, we're going to discuss that later as a really foundation, being a guidance counselor, being able to gain the trust of your clients, of our counselees, so that uh, we can have a cooperative treatment relationship with these clients. So I think having a master's degree is uh, real beneficial for us in terms of building our skills to facilitate correct counseling. So another also is being a licensed guidance counselor. So I think it's really important, especially if we're going to implement higher order intervention. So it's nice to have being eligible, being able to conduct practice, being licensed under law. No? So even though we are in a school setting, but take note that we are handling live patients. No? We are live clients with rights and uh, certain restrictions, or data privacies, feelings. So that is why it's really important that we are aware of these things, so that we can be more humane in our treatment. So having also a license is also a security, for our clients, just in case that uh, we will be more accountable, or negligible if there is a malpractice or there's a breach in the ethical standards. So those are the two basic, the master's degree, and of course is also a prerequisite to having a license for guidance counseling. The other is the certification as a substance use counselor. So in the country, we don't have this certification, but in the US and in other countries, there is what you call the specialization. If you want to be, if you want to specialize in counseling substance abuse disorders or clients with substance abuse, so you will need this specialized orientation and training. So you'll be more competent and apt in handling substance abuse clients uh, by being a certified substance use counselor. You'll be more familiar with the literature on substance abuse and the recent intervention. So we all know that there is a constant uh, trends. There is a constant innovation in terms of treatments, models of treatment to be more effective in handling clients with substance disorders. So being a certified counselor will give you access to the literature in order to be more effective in our treatment. So you will be able to have the facility to conduct standardized assessments, that are more suited to substance addiction, and you will also have the knowledge with self-help programs and materials. So there are a lot of self-help programs and materials that is specifically created for substance use patients, that they can do or perform self-paced at home, away from your regular session. So those are a plus, having this as a plus. So, but if we don't have the certification, then at least it's good that we're going to have the experience. So the other is familiarity with referrals. So it's really important to have options. When we have the options, these referrals, take note, should always be conducted in agreement with the patient, as much as possible. So whenever that there is a need to refer a patient, for instance, in involuntary hospitalization, if the addiction or the dependency is already beyond the physical control of the patient. So there's a possibility to refer the patient to inpatient treatment. So para safe, the patient can be safeguarded, or to protect the patient from having access to drugs in the community. So it will be more effective if the patient is confined in a particular facility. No, so uh, these are the more rigid approaches. What else? Other specialists. No, it's important that we also have a directory of other specialists like psychologists, uh, medical doctors, other professionals if there are other existing comorbidities, other present psychological disorders that may be beyond your experience or maybe beyond your specialization. So it's really important that we are not going to act out as a one-man army and try to solve or resolve all things resolve all the issues within our patient. So it's always prudent that if if you judge that it is beyond your capacity, so the prudent way is always to refer it to someone who is more capacitated or someone who is more competent or has the proper credential to conduct treatment. So other is treatment undergone to complete cases. So these are more on the experience. No? So as much as possible, um, you had completed already 2 cases, 8 sessions each. So experience is always the best teacher. No? So unless you were able to handle an actual substance abuse client, so it's really difficult. No? Like what we are doing right now. I don't know if someone if there is somebody among our class who had an actual experience no in the social work case or any case regarding patients with substance use disorder. So I think it's really difficult to simulate the personal struggles as a counseling or as a case manager in terms of dealing with the uh, physical, psychological, emotional struggles of a patient. So, of course, we can talk about the literature, but of course, the experience would be different. The struggles, the adjustment, the patience, frustrations, no, of being the case manager. So I think that's totally different uh, uh, perspective. No, if you are someone who had directly experienced handling this special population versus someone like I think most of us who are studying secondhand the difficulties handling this special population. Another is to have the supervised counseling experience. No, so if there is a presence of supervision, no, so that would be a great advantage. No, if we are going to be handling a particular case, we're going to do counseling. We're going to facilitate group sessions for persons with substance use disorder. So I think it's a real advantage if there is a supervisor, no, who will be overseeing our treatment with this patient. So there are various advantages of having a supervisor, and the other, some of it is the technical and emotional support for the facilitator. So we know that it's very taxing, no? It's very challenging, and sometimes, no, when you try to untangle all the emotional problems of a substance client. So sometimes those are very, uh, there is the presence of that compassion fatigue, no? Or sometimes you get lost because of the many problems presented to you. Sometimes you get lost. How are you going to go about the problems? No. So personally, I have done group focus group discussions before in my previous job, and I can really say that dealing with groups is 3 times difficult when you are conducting individual counseling. No, so I was fortunate enough during that time that during the during my facilitation of the group counseling, my supervisor is observing me. No, we have this special room we call the Big Brother room. No, wherein uh, we have there the sessions, and then we have this one side window, no, with the mirrors, and my supervisor will be sitting behind that window. No, he will be jotting notes during my group therapy session or my focus group discussion, and he will write down some of her observations, no, some things that I might not have observed, because when you are faced with five or more, or even four or more people, sometimes it's really difficult already observing all the nonverbals. When you will, the tendency is you will be overwhelmed by the so many so many individuals talking at the same time. So when you are in a group uh, when you are in a group counseling, it takes it takes absolute skill, no, for you to process the verbal information being fed to you, at the same time analyze all the nonverbals, analyze the dynamics of communication going on during that focus group discussion. So during my time, I was a new graduate, so I really had struggled. So personally, uh, I am just on that level. My level of analysis is on the level of the verbal exchange, no? So hanggang dun lang yung kaya kong i-process, and I can no longer observe all the non-verbal cues. I cannot observe all the things that are beyond the verbal. So I was fortunate enough that I have a supervisor, no, who will be looking for me, and who will be jotting down some of the information that I might miss. And after the session, no, so the supervisor, we're going to sit down. I am going to share the things that I have observed. I'm going to share the possible approaches or intervention that I'm planning to implement with this group. And then after that, she's going to give also her points, her notes that she had pointed out, and discuss. We're now going to discuss if the things that I'll be implementing will be effective, or does it coincide, or does it support the data that she was able to observe during my facilitation. So I think that is a very big uh, that is going to be a big that's a crucial thing, no, to have another perspective, observing or giving points while you are the one doing the actual counseling, no. So sometimes kapag iisa lang, no, so we'll just have a unilateral perspective. So it's really nice to have someone na not only who will be observing or giving a different perspective, but someone who is more seasoned. So yung kanyang insight, yung kanyang level of analysis will be quite different, and will really give me an enhancement. Also, when I draft the approaches, when I draft the final analysis, final assessment, and the planned intervention for this group, so she will also try to review. She will also try to scan my report, my case report, and she will also give feedback. No, sabi niya, okay, this is good. This is not, you can improve this. So it's really nice, no? Especially uh, in our profession as guidance counselors. It's always a learning process. It's always a learning curve. So it's a big advantage really to have supervisors present. No, so another advantage also is sometimes many times actually. there happens to there are certain incidences where I am overwhelmed. I really am overwhelmed with my uh, group group counseling. No, sometimes there are members of this particular group who has a very overpowering personality, or and sometimes parang you lose control of this group, no? So sometimes kapag may mga ganyang emergency, so but this is only during very emergency situation, so my supervisor would come in, or would I would excuse myself, and she will take over. She will take over for me and proceed from there. So those are the options, or if not, if hindi siya yung magsa-substitute sa akin, either pwede siyang join our discussion. I'm going to introduce her to the group, and siya yung magiging co-pilot for me during the group group counseling. No, so that's a good, what do you call this? That's a good alternative. That's a luxury to have a supervisor on hand. No, so those are the advantages if there is supervision, no, in our counseling. Um, uh, the last is the counselor's personal qualities. No, so I think this is the most crucial. No, later I'm going to present a literature study regarding the most important components in terms of effective interventions for clients with substance use disorders. And the number one component is the counselor's personal qualities. So, as counselors, as advisors, we are at the core front. We are the most critical component if a particular intervention or approach is going to be successful. No, so everything is hinged upon our participation, upon our enthusiasm to really help these clients. No, so as counselors, personal qualities, there should be an internal motivation to really help others. So dapat you have a genuine likeness for people, you have a genuine likeness to help others, because if you are just in for the money, so it's really difficult, no? Especially with these people, it requires a certain effort to make a genuine connection, no? Because these people, these clients, they can really tell, no? They can really uh, see, no? If you are not seriously into them, if you are not serious in terms of trying to reach out and extend help for them. So if you are someone who is not really genuine enough, no, to conduct this counseling or to have this intervention, so this profession might not be for you. No? Counselor or educator man. No? So second is we should be aware, no, of our biases. No? So sometimes we have our misconceptions sometimes spun around by media. So sometimes if we have these biases of our, so this can be hindrances. This can be hindrances in giving our full cooperation, in giving our full dedication in helping our clients. So sometimes if you're not going to address these biases, so this can be the tumbling blocks or the hindrance blocks for us to establish a working relationship with these clients. No, high degree of empathy, patience, and tolerance. No, so with these clients, no, especially with these clients, I think there is going to be a high degree of frustration, no, because substance use clients has the tendency to have relapse. No, so you are already on stage 3, stage 4, and then boom, nag-substance use, bumalik na naman sa 2, bumalik na naman sa 3. So, uh, as a counselor, you should always be extra patient, no? Extra understanding of the difficulty, no? Because it's really difficult, like what we have discussed earlier on the nature of the of these clients, no? Because substance has the biochemical influences, hindi lang kasi psychological, no? Hindi lang kasi social, but there is the biochemical influence that is really hard to address, no? And that's why uh, when the body and the brain is almost conditioned or designed, so napakahirap, and that's why there will be recurring relapse, there will be uh, recurring revert to the particular observed behavior. So it's important that as counselors we should be more patient. Another is we should be flexible to utilize various treatments, no? That's why na as what Mabel had uh, given emphasis, that we should explore, or we should be at least aware of the various approaches, various evidence-based interventions, because there is no one treatment for these patients. That is why it's critical that uh, when we see that this particular treatment is not going so well for this patient, so it's time that we should explore also another treatment. And we should be open to collaborate with other specialists, no? So uh, these patients had a very complex uh, disorder, no? It has a varying range of symptoms: physical, psychological, emotional. And that is why it's important that if we are not up to these symptoms, so it's good that we should solicit help also from other practitioners. So those are the basic fundamental competencies, no? If you want to be an effective substance abuse counselors. So we will now go to the interventions, no? So what are the evidence-based strategies that is present in literature, no? That is present being applied or being utilized to substance abuse clients, no? So before we discuss the actual interventions, we will try to tackle first the continuum of patient substance abuse recovery. So we can say that these are the different stages, different stages that our substance abuse clients are in, depending on their trajectory of recovery. So this was based on the study of Prochaska and Di Clemente in 1984. So we have 6 stages. So the first stage is the pre-contemplation. So this is the lowest stage, no? So clients are not thinking about changing substance, no? They may not even consider that they have a substance abuse problem. So ito pa yung ito pa yung stage na pinaka mahirap i-handle or i-deal yung mga clients, because there is a great deal of denial of the problem. They will try to deny that they have substance abuse. They are going to deny that they are fine, everything is in their control, no? Which is of course not. So this is the most challenging part, and ito talaga yung ito talaga masusukat yung skill mo, yung patient mo as a counselor. How are you going to engage? How are you going to convert the person in this stage, no? Because if you cannot be able to engage the person from this level, then there is no moving forward for recovery for this particular patient. The second is contemplation, no? So this is the next step. Now there is an increment improvement for the patient when there is the contemplation. So clients still use substances, no, but they begin to think about quitting the substance use. So if you try to give him uh, siguro information, no, psychoeducation on the harmful effects of drugs. So and then in some way, uh, as a counselor, you were able to convince the client to cut back, no, or to lessen the intake of substance. So the natural cognitive processing, no, will take place, and this is the time wherein the patient will be able to process or reflect of reducing the substance being taken. So the third step is the preparation. So there is still continued use, no, because substance dependence is really difficult to overcome. It's not going to be a one night, one day treatment, not 1 week or not even a 1 month treatment. So I think at least the if not immediate if not immediate uh what do you call this immediate abstinence, then at least gradual reduction of substance will be a good start, no. So in preparation they still use substances, but there is already the idea, no, they are entertaining already the idea to stop, no, because they have recognized the advantages. In some way they were able to realize, or they had already put into awareness the negative consequences, no, they had already seen the negative consequences that substance dependence had brought to their personal life, to the relationships with people around them. So in some way there is already the idea, no, of quitting the substance use and seeing the benefits of being clean from substance. So there is also the planning for change. The fourth is the action. So this is now the more concrete. This is now the more concrete phase of recovery, because it is during this stage wherein the client is involved now with concrete or actual steps of stopping substance use. No, it is during this stage wherein the patient learn the coping skills, learn the various mechanisms for them to uh, control or moderate their urges and their cravings to use substances. So this is the most significant part. No, this is the target. This is our target as counselors to be able to engage our clients, be able to engage our patients to participate and collaborate in taking action to help themselves. No, so this is the starting point, the actual starting point, no, the concrete starting point towards substance dependence recovery. No, then we have the maintenance, no, and the recurrence. No, so in the near future, no, sometimes they will experience relapse, they will experience setbacks, no, but it's always important that we continue to follow up these clients, continue to uh, emotionally support them, no, so try to try to encourage them, help them appreciate all the what do you call this appreciate them all the gains, appreciate all the positive steps moving forward no, and not dwell on the relapse, not to dwell on the setbacks, because sometimes if clients dwell on the setbacks and they become too guilty, then all the more silang magbabalik, all the more silang magre-revert doon sa mga earlier stages. So sometimes ang kailangan lang nila yan is to encourage them na okay, sige lang, try to do better next time, try to be uh, we give them additional support, we give them additional options how to minimize yung present mga relapse incidences. So, yun lang naman. No? So, maintenance and then recurrence. And usually, when these patients develop already these coping skills, they have developed already the proper cognitive functioning, then they can regulate already for themselves. So from time to time, kailangan lang nila ng affirmation, no? So that they can be more uh, they can be more stronger, and they can be more resilient and resistant, no, against relapse. So we have now the assessment, no. So this is the initial stage, no. It's really important, no, the to have this assessment. Like what I've said, uh, assessment is important because through assessment we will be able to identify what is the stage of abuse, what is the extent of the substance use problem of the patient, so that through the assessment we can identify what are the possible interventions, or do we need additional referrals? Do we need additional uh, professionals to help the client? So it's important to have the assessment, to benchmark, uh, assess and diagnose the problem of the patient. And of course, as we go on with our treatment, we go back to this initial assessment and see if there is improvement. So through this initial assessment, no, we can also determine if the patient had achieved already the status of recovery. So assessment is very important. Should be the very first priority, no, before any intervention. So these are the general assessment usually done with patients with substance abuse. So we can see that it is a very comprehensive assessment, no, covering medical, physical, psychological, mental, and even uh, social environments. No? We also have the drug abuse history. No? So we also try to assess what specific drugs being used, patterns of use, no? Because like what we have discussed, specific drugs have different effects to our brain and to our system. So it's important that we know what are these substances, so that medical wise, we know how to counteract the biological effect, or the uh, chemical effect to our brains. How are we going to correct the or alter the effect of the drugs through our through our brain or through our system, using perhaps detoxification. Here are some of the specific assessment instruments commonly used for substance abuse patients, no? Patients with substance abuse problem. So we have the addiction survey index, we have the drug use screening inventory, no? Drug use screening test, the Milligan alcoholism screening test, and of course the random urinalysis or breath analyzers. So what are the duration and setting of treatment? So usually we have three types. No, we have the short-term inpatient care, no, which lasts 3 to 7 days. So if the patient has a severe uh, dependency, no, severe dependency with substance, and the person has a total uh, absence of control, no, and perhaps there is already a presence of induced psychological disorders. So the most effective way is for inpatient care. No, papasok talaga siya sa ano, hospital or sa treatment facility, and the person will be confined there for 3 to 7 days, perhaps for detoxification and other more medically oriented approaches. For other patients, however, who are more on occasional users but not dependents, so intensive outpatient care can be an option. No? So this might last for 8 to 12 weeks, either through individual counseling or for group counseling sessions. We also have there the halfway house, or we have the, usually here in our country, we have the rehabilitation treatment. So this is usually up to 3 to 6 months. This is structured and supportive residential treatment. So we have the rehabilitation centers, or we have the community-based uh, rehabilitation facilities. So we have here the common treatment and intervention phases. So this intervention phases is also similar to the continuum of motivation by patients. So we, for this intervention phases, we have a four phase. No, the phase one is engagement and stabilization. So phase one is the most critical and the most important, no, especially for those with patients with severe substance use disorder. No, so engagement and stabilization is more on detoxification. No, it involves more on removing the chemicals in our system, no, because if we cannot remove the chemicals in the system, so mahirap i-engage, no, it's difficult to engage the patient in doing anything, no, you cannot talk to these patients concretely, no, if there is hallucination, if there is mania, if there is severe depression, if there is anxiety or whatever symptoms of psychosis. So it's almost impossible, no, to conduct counseling during this phase. So that's why the word there is stabilize. We need to stabilize the patients psychologically, mentally, and emotionally through detox, through use of medication. So during this phase, there is a great uh, this can be done voluntarily or involuntarily. No, so involuntarily if the patient is without capacity. No, and also sometimes that's why it's in the burden of the counselor or the family, no, to have the patient forcefully engage into detoxification. So that's it. Phase two is on the early recovery. No, so in the early recovery, no, so this is more about psychoeducation, no, encouraging the patient, challenging his denial of the problem. So sa phase 2 early recovery, napakalaki yung role na gagampanan ng counselor in this stage, because this is more of more directive yung approach, no. Ikaw yung mas magdidikta, so to speak. Ikaw yung magli-lead doon sa treatment, doon sa counseling treatment ng patient, no. So it will really test your ability, no, to convince the patient, to engage the patient, to collaborate and to cooperate for his or her treatment, no. So that this is very crucial, no. because uh, the detox or the stabilization uh, phase will be fruitless if you will not be able to convince the patient to proceed with the treatment. No, if the patient will continue to uh, to be non-participant, no, in the recovery phase. So sa early recovery, no, ito na yung point wherein we try to convince the patient, engage the patient to be a participant in the intervention, in the recovery process. No? So during this early recovery, no, usually we are not uh, we are not confronting, no. We also try to avoid harsh confrontation because sometimes kapag kino-confront natin na beyond their ego strength, so sometimes nag-aano yan, ah, yung mga patient nagsha-shy away. They shy away with the treatment, or parang they get alienated instead of being encouraged. Parang they get offended, parang as if na you are very harsh and you cannot relate to their struggles. So we should be careful in terms of confronting the patient with his substance difficulty. No? So also during this time, no, hindi pa natin sila pwede mag-explore yung mga mas malalim na mga problema. No? So usually uh, we just focus muna doon sa substance addiction, no? Hindi pa doon sa mga uh, problems with the family, problems with personal difficulties, or what are the initial causes that brought to substance addiction in the first place. So, hindi pa tayo pwedeng magtanong about yung mga psychodynamics, no? Because hindi pa ganon ka-stable yung patient. So, usually in the latter stages of the treatment, we can do those things. So, phase 3 is now in the middle recovery. So, middle recovery, medyo yung patient, they had already developed the coping skills, no? The intrapersonal skills, no? Intrapersonal and interpersonal skills. So, in the middle recovery, we try to introduce to the patients how to deal with their frustrations, how to deal with their difficulties in healthy means and in healthy ways. No? So, kapag sila ay nadidepress, kapag sila ay malungkot, uh, we try to teach them with healthy outlets, no? Whether exercise, whether having hobbies, or siguro try to get them employment, give them livelihood, no, na pwede nilang pagkaabalahan, no, instead of uh, reverting back to substance use or to drugs. And also interpersonal issues, no, teach them how to communicate with other people, teach them how to approach people if they have problems and if they have difficulties. So sometimes drug abuse patients, sila yung mga tao na nahihirapan magkwento sa ibang tao. Sila yung mga taong nahihirapang uh, i-resolve yung problema nila sa ibang tao, no? Like in the family. And that's why their quick solution is to go into drugs. No? But these are the things that we want to correct. No, we want to eliminate the risk factors and turn them into uh, protective factors, no, so that they can proceed with their recovery. And the final phase is the late recovery, no, also known as the maintenance phase. No, so more or less they had already developed the coping skills. So just like I said before, it's just a matter of conducting follow-ups, ensuring that uh, the patients the patient go through with the treatment plan, no? Make sure that they are aware of the various triggers, no, that would protect them from having relapse. No? So to make sure that they know how to react if there are triggers present. No? So yun lang naman, no, the recovery phase. So here are the counselor's role and function. So actually, I had already touched much of these roles and function. No? So usually, yung pinaka-importante lang naman dito is the initial phase of the intervention. No? Kasi sa initial phase of the intervention, like what I've said, it's the counselor who will be more directive, ikaw yung mas magli-lead on, ikaw yung mas kokontrol doon sa treatment ng patient, no? Ikaw yung mag-guide kasi nga lost pa, no? Ang patient na kaka-detox or may konti pang presence ng substance sa kanyang system ay lost pa. Hindi pa niya alam kung ano yung dapat niyang gawin, anong direksyon, saan siya mag-uumpisa, ano yung mga pinto na dapat niyang pasukan. So, during the initial phase, ikaw as a counselor, no, ikaw talaga yung magli-lead pa sa kanya, no? Unti-unti you build up his capacity, you build up his ability, no? So that eventually as you go along with the therapeutic process, unti-unti you build up na kumbaga you train the person to be eventually independent, no? Kasi hindi rin pwede na all throughout his recovery, ikaw lang lagi magsasabi kung ano yung dapat niyang gawin. No. No, because hindi yan magiging sustainable. Hindi naman kayo magkakaroon ng isang lasting relationship. So, in the initial stages, no, you're going to lead, you're going to show, no, you're going to model ano yung kanyang dapat gawin, no, to overcome. But eventually, i-empower mo rin siya, no? I-empower mo rin siya na kahit wala ka na, no, kahit na hindi na siya magre-report sa iyo, kahit hindi ka na magfo-follow up sa kanya, siya mismo marunong na siyang mag-manage sa kanyang sarili. That's why in the latter part, hindi ka na gano'n ka hindi ka na gano'n ka observant, hindi ka na gano'n laging nagmo-monitor sa kanya because eventually yung control, no, is unti-unti ibibigay mo siya sa kanyang sarili, no? Kumbaga you're going to empower the person to manage his own or her own recovery, no? So yan yung practice, yan yung recovery na dapat natin gawin, which is going to be more sustainable in the long run, no? So that's it. Therapeutic alliance, no? So yan yung pinaka-importante, no? Therapeutic alliance. So yung rapport, you know, you're going to build up the rapport with the client, no? Na ipaparamdam mo sa client na you are really there to help the person. You are willing to extend a portion of yourself, a portion of your skill, a portion of your expertise, no, to really help and support the person. Number one yan. Number one yan na dapat iparamdam natin uh, sa client, at the same time sa family rin. No? If you're going to involve the family in the treatment of our clients. No? Ano pa? So, individual counseling. No? So, ito yung mga this is the common setup, no, we have, no, individual counseling session. So siguro yung advantage ng individual counseling is that the counselor will be more able to focus on one client, no, mas mapag-uusapan in detail kung ano yung mga problems, kung ano yung mga struggle. So, yun yung kanyang advantage. So, yung disadvantage lang siguro is mas mahal. No, it will be much costly and it's going to be uh, time consuming. Kasi individual yung counseling. No? So, I think we are familiar naman with individual counseling session. So, the other is the group counseling session. So, we had also discussed the various advantages of group counseling session. So, we have the positive peer support and yung advantage kasi ng group counseling is that uh, kapag yung mga kasama niya sa counseling ay mga taong nagkaroon din ng substance abuse problem, I think walang issue ng credibility, no? Parang kasi pag ikaw as a counselor hindi mo na experience na yung mga challenges ng isang substance dependent. So sometimes mahirap mag-insist ng credibility na alam ko yung nararamdaman mo, alam ko yung pinagdadaanan mo. So it's really difficult for the patient to believe that because you have never been there, no? But if you have this uh, group, no, wherein the members had really been there, no, so there is credibility, no, and there is that sense of identification, no, with that fellow patient. There is a sense of affirmation, no, and hindi ganon kahirap magkaroon ng confrontation because like what I've said, na-experience niya yung ganon. But ikaw na hindi ka naka-experience, so there can be a problem with that in terms of confronting the patient. Another is having this group counseling session wherein the patients are fellow recoveries also. So it's a good in terms of being a substitute family. No? So sometimes yung mga pamilya ng mga substance problem as clients with substance problem, sometimes they are not that supportive. Sometimes hindi rin nila maintindihan yung pinagdadaanan ng person na may dependency. So unfortunately, sometimes the family is not an ally. Sometimes the family is not an ally for the recovery of the patient. No, and that's why having this group is an advantage in terms of providing the client with people whom uh, can provide with the necessary understanding and support, no, that uh, these persons might need. Okay, what else? So there are various uh, group models used in the group counseling for substance use. The most common is psych education groups. So sa psych education, ang focus nito ay increasing the awareness, no? Awareness and consciousness of the members in the groups. No? Explaining what are the disadvantages of substance use, what are the advantages of being clean from substance. So, yun yung kanyang focus, no? Giving education to the group members. Sa skills development naman is uh, enhancing the competencies, no? Yung skills, specifically how to avoid relapse, how to face triggers, how to develop interpersonal skills, how to deal with other people without resorting to aggression. No? So those are skills development that are integrated to these patients so that they can deal with real world difficulties without resorting to drugs. In cognitive behavioral groups naman, this is more about challenging false beliefs and false attitudes about substances. No? So we had already discussed about shaping, no, about conditioning. So this is involved more on the cognitive behavioral groups. Sa support groups naman, ito yung kanilang focus is more about emotional support. No? It's more about uh, giving emotional solace, giving emotional uh, what do you call this? Emotional asylum or emotional safe space for the members, no, in order to be in order to have to gain strength, in order to gain resiliency. So sometimes it's not just enough na ah, marunong kang mag-counteract ng mga false beliefs, no? Minsan kailangan mo rin talagang maramdaman na may mga taong who really cares for you. May mga taong who genuinely accepts you. May mga taong genuinely encourages you to recover. So, yun yung focus naman ng support groups. No? So, para silang brotherhood talaga na talagang paparamdam talaga nila sa'yo na they are there for you to recover. And the interpersonal process groups, ito naman is more on the psychodynamics, no? About your, uh, more about sa history, no? Yung mga false beliefs, yung mga uh, ego and psychodynamic uh, issues in the past. So, yun naman sa interpersonal process groups. Paano mo i-improve ang iyong relationship circles in your environment, no? So that after your recovery, kapag maayos na yung pakikitungo mo dun sa pamilya mo or sa mga katrabaho mo, then hindi mo na kailangang mag-resort into drugs or substance. So we have here the current trends and practices, no? So ano pa ba? Uh, we try to focus on the client competencies and strengths, no? So kung ano yung mga strengths niya, ano yung mga initial niyang mga hobbies, ano yung mga initial niyang mga ginagawa before indulging into substance. So we go back to that. No? We try to encourage the positive things, the positive aspect within the patient with the idea of supplanting it with the substance use disorder. So, dun lang tayo. No? We try to focus on the competencies and strengths. Also, the individualized client-centered treatment. So, there is no one generic treatment. No? Hindi, as much as possible, the ideal talaga is iba-iba kasi yung issue ng bawat patient. No? Nag-drugs ako dahil may frustration ako sa pamilya ko. Nag-drugs ako dahil it is uh, my outlet when I am frustrated. Nagda-drugs ako because it's my way of coping up with the pressures at work. So, iba-iba yung mga struggles, iba-iba yung mga reasons why patients indulge into drugs. And so, their treatment, their intervention should also be individualized. No? Hindi dapat pare-pareho because kung ang doktor, iba yung kanyang medication, iba yung kanyang approach sa taong may, let's say, heart problem or may heart condition versus sa taong may diabetes. So, ganun din dapat, no, sa uh, taong may substance problem na iba naman yung kanyang pinanggagalingan. So ano pa, acceptance of new treatment goals, no? Adoption of a recovery paradigm. So dapat mas positive tayo, no? So the treatment nowadays is not so much more about how to avoid drugs, no? Hindi na more on how to avoid drugs, but as much as possible, how can we interact, how can we engage into positive activities, positive uh, channels or outlet that can alternate or can supplant the drug addiction. Okay. The other is ano pa, integration of treatment in multiple disciplines, no? So we have the primary care, mental health and addiction, the use of evidence-based practices, and the use of medications, telehealth also. Because of the onset of the pandemic, so important din na kahit papaano yung treatment tuloy-tuloy kahit na walang face-to-face, no? So that's why we have the telehealth technologies such as the support groups, chat support forums, online video, and psychoeducation. So, ano pa ba? So, principles of effective treatment. So, addiction and mental health issues are complex, no? But they are treatable conditions that affect brain, body, and behavior. No? So, I think from the earlier video we had on the nature talagang marami yung mga aspects na naapektuhan because of substance use. No, and that's why na when we have the intervention, when we have the treatment, dapat full holistic yung ating approach, no? We have the treatment for the brain, we have the treatment for the body, and how do we implement behavior modification to reduce the indulgence to substance. Another is no single treatment is appropriate for everyone. That's why we have multiple interventions. Most of them are already evidence-based. So there is no one treatment that is going to be receptive or that is going to have a successful response to clients. So the response or the effectivity of treatment will vary depending on the patient. So, like what I've said, it's nice that we have a menu of interventions that will be our options in case that one treatment uh, does not help the patient move forward in terms of his or her trajectory for recovery. What else? So when we talk about treatment, no, not only do we include also the mental assessment, but it's also good that we're going to look after the nutrition and also the living conditions. No, so it's important. No, that's why na there is a shift in the drug treatment approach in the country. No, we are now focused more on the community-based program. So wala na yung mega rehab. No, we are now shifting from that paradigm na mega rehab, no? Because when you try to rehab the person, okay na rehab siya, okay siya, pero paglabas niya, did you rehab the community? Is the community now sufficient or ideal enough to receive the recovered person? So kasi kapag na-rehab siya pero pagdating niya sa community, the same risk factors are still present. So, useless lang din. Mahihirapan din yung client mag-recover kahit na meron siyang mga skills. No? So, that's why na our government is now focusing on the community-based rehabilitation. No? Na more siyang holistic na not only are we going to rehab the person but rehab also the community, no, so that the community itself will be the rehab environment for the individuals. Hindi na sila mapapalayo sa kanilang pamilya. They will not be confined to some facility away from the community. No? So this community-based program is much more sustainable, much more what do you call this? Positive or much more long-term compared to facility rehabilitation. Okay. Treatment plans must be continually modified, no, to persons changing needs. So like what I have mentioned earlier, so iba yung ating approach sa patient initially. No? In the first stages, our approach is different. No? Uh, pero habang tumatagal yan, no, we eventually we loosen our directiveness. We try to empower the patient to uh, take on the responsibility of his or her recovery. So, nagbabago yung ating treatment depending on the uh, progress the patient makes in his or her trajectory of recovery. Okay. So before we go to the models of treatment, I'm going to show again, no, the video that we had on the rehabilitation approaches being observed here in the country. And through this video later, no, after I present this video, we can have a short exchange of ideas. No, what are your thoughts on these approaches? Or if you can relate, if there are any initiatives in your community of a similar intervention being implemented for PWOODs or people who use drugs, so or any advocacies or campaign that you are implementing on your school. No? So let's discuss that after this video presentation on rehabilitation sponsored by the uh, Department of Health.
Cutting their hair at home. Are you introducing Mike?
Alagang kapatid.
Matapos tayong mabigyan ng background ukol sa drug addiction bilang isang sakit, dadayuhin naman natin at papasukin ang isang government-operated rehab center. Paano nga ba nababago ng mga programa ng DOH ang isang drug addict?
Sa likod ng rehas na bakal, nililibang ng 28 anyos na si Ben. Hindi niya tunay na pangalan ang sarili sa paglalaro ng chess. Pampakondisyon daw niya ito bago simulan ang isa na namang araw sa itinuturing niya ngayong tahanan. Dati raw king kung ituring si Ben sa sariling kumpanya bago maging pasyente ng Treatment and Rehabilitation Center ng Department of Health dito sa Bikutan. Pero sa ngayon, mga pyesa ng chess at ang sariling pagkatao muna ang kailangan niyang asikasuhin.
Nalaman ko na hindi po ako tunay na anak, pati yung kapatid ko. Dumating po yung point na nagrebelde po ako sa amin. First year high school pa lang, naninigarilyo na ako, umiinom na ako, napabarkada na po ako. At simula akong magmarijuana, tumikim rin ako ng mga X Pinoy, yung parang cup syrup po.
Gaya ng maraming drug addicts, nagsimula sa patikim-tikim si Ben hanggang sa tuluyang nahumaling.
Ultimo yung gamit ko, yung damit ko, yung TV namin sa bahay, nasasanla ako na po sa source. Talagang nakikipag-away na po ako sa labas. Yung mga alahas ng mama ko na mamahalin, binenta ko. Yung sasakyan, Binenta ko rin po pampalit sa mga shabu.
Dahil sa labis na hiya sa mga taong nag-ampon sa kanya, Abril ngayong taon nang voluntaryo siyang pumasok dito sa TRC.
Sinabi ko po sa magulang ko na gusto ko na magbago. Gusto kong alisin yung mga masasamang gawain ko.
Pangunahing misyon ng DOH Treatment and Rehabilitation Centers na maibalik ang nawalang respeto sa sarili ng mga pasyenteng nalulong sa ipinagbabawal na gamot. Pero para magawa ito, kailangang sumailalim ng bawat pasyente sa isang therapeutic treatment para gamutin ang sakit na unti-unting sumira sa kanilang kalusugan, pag-iisip at pagkatao.
Ang tawag po sa program na ginagamit natin dito ay therapeutic community. What we do actually is to enhance the psychological defense of the person against substance use in many different ways. They also undergo yung behavior shaping tools. For example, meron kang palaging ginagawa na mali. A person would go through all those tools, starting of course making you aware na, Brad, kapatid, mali na yung ginagawa mo, kailangan baguhin mo. It's more of a talking to.
Mula Lunes hanggang Sabado ng umaga, nagsisimula ang araw ng mga pasyente ng isang dormitoryo sa isang morning meeting kung saan pinag-uusapan ang mga tuntunin sa rehab. Mapalad din kaming masaksihan ang affirmation kung saan kinikilala ang mga disiplinadong mga pasyente. Pagkatapos ng group counseling, dito na sumalang si Ben.
Mga tao lang to, nagpamalasakit lang kayo.
Lahat ng bagay o mga problema na gusto mong sabihin, pwede naman pong pag-usapan ng maayos. Na rin, meron pong mga problema sa bahay, may problema sa kapwa residente, pwede nyo pong i-pull ups po doon. Pwede nyo i-concern. At yung susunod po sa pull-ups is affirmation. Ina-affirm mo yung mga nakakagawa sa'yo ng mabuti.
Bahagi rin ng araw-araw na programa sa center ang bigyan ng gawain ang bawat pasyente sa pamamagitan ng departmental task o gawain sa loob ng kanilang dormitoryo. Ginagawa ito para bigyan ng sense of responsibility ang bawat pasyente. Ngayong araw, pagbabantay sa gate ng dormitoryo ang kailangang gawin ni Ben.
Hats back.
Sa oras naman ng kainan, disiplina pa rin ang pinaiiral sa bawat pasyente.
Ano ulam mo ngayon?
Veggie meat.
Sagot din ng center ang pangangailangang medikal ng bawat pasyente sa tulong ng fitness gym, pati na rin dental at medical clinic. Gaya na lang ni Ben na may sakit na diabetes at kailangan na ng insulin maintenance. At bago matapos ang araw, may one-on-one counseling ang bawat pasyente. 2 beses naman kada buwan isinasagawa ang family counseling kung saan nakakatanggap ng dalaw ang bawat pasyente. Sa ngayon, nasa 9 na dormitoryo ang nagsisilbing tahanan ng humigit kumulang 1,600 pasyente. Lahat sila sumasailalim sa programa mula 6 na buwan hanggang 1 taon.
The whole program in itself is to take care of the holistic or total well-being of a person. To develop a person and develop his psychological, physical, and social aspects so that he can better fight off the temptation of drug use. All of that comes in combination. They have to pass through all of that.
Bago magtapos ang araw, dinalaw naman ng Metro Pacific Investments Corporation o MPIC ang Bikutan TRC para magpaabot ng suporta sa mga pasyente.
In-invite kami ni Dr. Bien dito para makita ang facilities at nakita namin yung mga kakulangan. So ito, nabigay namin na board games at saka mga toiletries, mga pangunahing tulong lang naman yan eh. Mas madami pa kaming nilalaan para sa kanila.
Sa ngayon, nagbibilang na lamang ng araw si Ben bago matapos ang kanyang pamamalagi sa TRC.
Yung mga tinuro po sa akin dito, ma-apply ko hindi na po ako makakabalik din sa dati. Sa ngayon po, naiintindihan ko na po yung mga ginagawa po namin dito dahil marami na po akong natutunan. Hindi rin po binalik yung pagtitiwala sa akin.
Isa lang si Ben sa maaaring magpatunay na may pag-asa pang naghihintay sa mga tulad niyang biktima ng iligal na droga. Na kahit minsang nagkamali sa kanyang galaw sa laro ng buhay, may pagkakataon pa rin ibinibigay para muling makabawi at maibalik sa kanila ang respeto ng pamilya at lipunan.
Nanalo na ako.
Okay, so far, what are your comments? What are the things that you have observed on the interventions being implemented in our local rehabilitation centers? Any feedback on that, or anything that you can share on the similar interventions that you had also observed in your communities? Okay, so we will now proceed with our sharing and thoughts discussion. And after this, I will proceed with my final set of presentation. So thank you, everyone.